I just can't imagine living as a woman. Nope, not one bit.
Null.
Whatever created my body just made a mistake during production.
At first, I wondered if this was really what she wanted or just a phase. I just didn't know.
It was kind of a shock at first.
Are you really trans? It's not a choice. The choice is, will I go with it, and if so, when?
When children and adolescents feel their bodies are the wrong gender, they experience a lot of distress, and their parents face difficult decisions.
What's okay? Where should I say no? Where can I say yes?
And what if it's just a phase?
My worry is that my child will undergo disfiguring surgery, which might then need to be reversed years later. That's what worries me.
Medical treatments involve risks, but doing nothing can be risky too. How much do scientists really know about trans identity and the long-term consequences of gender reassignment? We accompany 3 families as they wrestle with momentous decisions. They all have pressing questions. How do we know if this trans identity will remain? And what is the right decision for our child?
I'm Emilio, I'm 15 years old, and I'm a man. That's just clear to me. When I think back now, I've always been a guy. I may have looked more feminine, but I was always a guy. When I reached puberty, my breasts started to grow. I didn't know how to handle that at all. I still don't. And for an 11-year-old something, that alone was already a bit too much.
Emilio has 2 younger sisters. They live in a blended family near Klagenfurt in southern Austria. It was in a situation much like this one that Emilio, at the age of 12, stated that from now on he wanted to be addressed as a boy.
He used to describe himself as a boy-girl. He would always say, "I'm a boy-girl." Although he tried to fit in, he was more of a tomboy, I'd say.
His mother, Alina, says that looking back, his transformation was recognizable. The closer he got to puberty, the more boyish Emilio dressed. Alina also noticed that he wasn't happy and often down.
It was in middle school that he came out. We were sitting at the kitchen table, and Ami had kept telling us that he wanted us to use the male pronoun for him now, and to just call him Ami. And then Lilia, the youngest, said, "But if you become a boy now, Amelie will disappear." And that's when I realized that Amelie was actually disappearing. But that I was gaining a son. It was difficult. I felt an enormous sense of loss at that moment. I had to leave the room. As you can see, it still moves me now.
Since coming out, Emilio's life has been a struggle. Because he was born a girl but identifies as a boy, he's exempt from physical education at school. One of many significant changes. Only with his sisters Lilia and Maya has nothing changed.
I support him by calling him brother.
I back you up when talking to Dad.
True.
Yeah, I know.
Maya and Emilio have the same dad, but live with their mom. Since their parents separated 12 years ago, their father Manfred has lived in the neighboring village, just a few kilometers away. Emilio has told him that he now identifies as a boy and wants to be addressed as such.
Yeah, for me it's a disaster. When Maya tells me about something that happened at home, for example, she'll say he did this or that. And at first I don't know who she's talking about. I think, but that's my little Amelie. I don't want to call her Emilio. She knows that. Ami is okay. That's my compromise. She's always wanted my support. But I can't support something that I don't feel inside. I have to stay true to myself, otherwise I couldn't look myself in the mirror anymore. I still think it's just a craze of puberty.
Emilio is keen to convince Manfred that his transgender identity isn't just a teenage whim. He wants to live as a boy and also undergo treatment for gender reassignment. How should parents respond when their children believe they're a different gender and want to take steps to transition? At Münster University Hospital, doctors are studying transgender development in children and adolescents. They also advise parents whose children have come out as transgender.
I'm Georg Romer. I've been helping young people with questions about their gender identity for over 30 years. Encouraging people to explore who they are is never wrong. Some young people don't stick with being trans. They just believe for a short time that they're transgender. For them, we learn that it's often through this process of exploration that they come to realize they don't need to change their bodies. They can be an atypical man or woman.
For those teenagers, the sense of being trans is only temporary. Science can't reliably predict who that will apply to. There's no 100% certainty. Experimenting can help determine whether the feeling of being trans is permanent or not. That's what Emilio is doing. He's now living as a boy. His mother has agreed to it, but his father is less understanding.
It made me sad, more sad than angry. At most, I was angry with myself for being the way I am, but I was sad that my biological father can't accept me the way I am and the way that's good for me.
Emilio uses a compression garment or binder to flatten his chest. That makes him feel better. He often struggles with anxiety and bouts of depression. And he's started self-harming too. Self-harming is more common among trans teenagers than other young people.
I just didn't feel right in my body. And that was reason enough for me, because I wanted to change my body. And so you try to fix it somehow by hurting yourself or whatever.
Alina felt shocked and helpless when she discovered Emilio was self-harming.
It's terrible for me to think that my child is rejecting his own body. He rejects the gender assigned to him at birth and wants to live differently. I can't imagine what it's like walking around all day with your chest bound up like that. I see the back pain he has as a result, but it's just a need that he has to flatten his feminine chest.
Before Alina agrees to any medical interventions, she wants to be sure that Emilio's trans identity is permanent.
When you have a transgender identity, all the male or female characteristics that develop physically with the onset of puberty are experienced as deeply unfitting to who you are. It's something completely different from struggling to fit with gender roles. And it doesn't stop. It's like a switch has been flipped. And when you listen to these people, you understand that their suffering is existential.
But not all young people that identify as trans suffer to the same extent from their physical sex characteristics.
I'm Blake. Right now I certainly don't have the feeling that this is just a phase, but I would never say anything about the future, because you don't know what the future holds.
Blake is 17. Physically, he's also still a girl, but since he was 15, he's lived as a boy, with the support of his parents.
I thought, okay, there's not much Blake could have shocked his parents with. But he found something.
I didn't see it coming at all.
Me neither. Definitely not.
Never.
Blake's mother, Mika, has difficulty speaking due to a neurological condition affecting her tongue. She says although she was skeptical at first, she still trusted Blake. Today, the three of them are planning to watch some old family videos. When Blake came out, Volker and Mika assumed it wouldn't last long. Her name changed from Charlotte to Charlie, which they didn't find so difficult. At the age of 15, Charlie went to Canada on a school exchange. During a video call, he told them that from now on he only wanted to be called Blake for good. Mika and Volker accepted his decision. But then Blake also wanted to use a binder on his chest.
That did lead to some friction. I found my emotions boiling over. I said it was out of the question. That only came when he expressed that desire. Where I thought, no, to bind up your chest at that age, I don't want that, period.
Volker wondered whether Blake's gender identity was just an expression of the prevailing youth culture.
This generation is exposed to so much quite naturally through social media and all the games where they adopt a persona. And the whole thing coincided a bit with COVID. Then there was the cosplay craze.
Wow. The costumes were varied and blurred classic gender lines, as is common with cosplay roles.
Cool, okay. So, because it came out of this phase with these role-playing games and cosplay, I didn't have the feeling, speaking for myself at least, that a switch had been flipped. From now on, I'm a man, so to speak. To me, it felt more like this was now an option.
But most researchers believe that transgender people aren't able to just choose their gender identity. The University Hospital of Ulm also offers special consultation hours for children and adolescents who feel like their bodies are the wrong gender. The doctors here first seek to rule out any health-related factors that may be influencing a trans identity.
I'm Mark Alroggen. I'm a psychiatrist and psychotherapist for children and adolescents and a senior consultant at the hospital. There are certain mental health conditions that can also cause severe disruptions in identity development. In some cases, these may be psychotic disorders, but they can also be severe personality disorders. And in rare cases, they may involve severe traumatic experiences that cause a person to feel like they no longer belong to the gender assigned to them at birth.
To rule that out, specialists in endocrinology, psychiatry, and general medicine work together. Their conclusions are incorporated into a child and adolescent psychiatric assessment, one of the prerequisites for any medical intervention. That's in line with the latest recommendations in Germany for treating trans children and adolescents. But not everywhere has specialists like here in Ulm. Critics fear that assessments are often made prematurely.
We believe it's important that the young people are sufficiently stable, mentally and emotionally, before undergoing a medical transition. Have they really considered the potential positive and negative consequences? And are they able to put them into perspective? It's important that the transition feels coherent and consistent across the board for young people.
That's why they recommend that young people try out their perceived gender for a year first. Only once the expert assessment is complete can the transition, the physical gender reassignment, begin. And here there are various options. In the earlier stages of development, puberty blockers can be used. This medication doesn't change the person's gender, but it can delay the body's maturing process for 1 to 2 years. During and after puberty, hormones can be used. The male hormone testosterone is responsible for male development, while estrogen is responsible for female development. Later on, some undergo surgery on their breasts, vulva, or penis, but by no means everyone opts for that path. The individual steps of the transition are entirely personal.
My name's Kira. I'm 17 and still at school. I would basically always say that I'm a girl or a woman, but in certain contexts you have to add the word trans.
Kira has lived as a girl now for 5 years and is already undergoing physical transition. She was 12 when she realized that she was a girl, but her body was just about to develop into a man, a situation that she found extremely distressing.
Of course, it was difficult at first, knowing that you were entering puberty and that things would develop. So in my case, my voice, facial hair, body hair in general or whatever, and I realized that that was not what I wanted.
Kira has 2 brothers who are 13 and 19. In 2021, she withdrew to her room for weeks watching videos and drawing. Then one evening in July, Kira opened up to her parents and told them she was a girl.
Kira came to us and said she needed to talk to us. And that was when she told us. You could see that something had been bothering her. She spent a lot of time in her room back then.
I said to her, think about it. Is it really that you're a girl, or is it just that you're not the stereotypical boy? There are lots of boys who don't fit the stereotype. And then she went back to her room and spent a few more days thinking about it. Then came back and said, nope, it's not that. I really am a girl.
Kira's parents, Stefan and Sandy, made appointments with a pediatrician, an endocrinologist, and a psychologist. If their child really wanted to live as a girl, then it wouldn't be good if her voice were to break.
If she had had to go through male puberty, it would have been incredibly distressing to her, and it would have undoubtedly led to complications. She was in a complete panic. I've never seen her so panicked as when the pediatrician said, well, puberty is starting to kick in now. We need to take action. She was completely distraught and panicked.
It was a dilemma. If Kira's parents did nothing, she would have male characteristics for the rest of her life. But immediate hormone therapy, on the other hand, would have interfered massively with her physical development. They needed time to make a decision. Kira's psychologist suggested pausing puberty with so-called puberty blockers. That would keep her body childlike for longer. Is that a good option for all children struggling with their gender? Back at Ulm University Hospital, Professor Martin Wabic is an endocrinologist.
I'm a pediatrician and specialize in hormonal disorders in children and adolescents.
In Ulm, the blockers are prescribed, but only after thorough consideration. Because the medication suppresses the release of sex hormones, it also carries risks.
The puberty blockers ultimately interfere in the natural development, the biological process of puberty. They stop it, and that certainly has side effects. And many of these side effects have not been well studied. So when I speak to the parents or the young people themselves, I can tell them what I'm going to do, and I can tell them what will happen in 1, 2, or 3 years' time, but I can't say how it will be in 20 years' time. And that's what makes puberty blockers so difficult.
Health authorities in several European countries recommend caution when prescribing puberty blockers. The drug can have a negative impact on the liver, bones, and brain. Kira's parents opted for the puberty blockers. She took them until she was 13. She experienced no physical problems or noticeable side effects. But some teenagers who think they're trans later change their mind in the course of adolescence. They run the risk of regretting any medical interventions.
In my opinion, you have to look together with the psychologist and the child to see, is there really a chance that the child will grow out of this? Or am I just making life more difficult for the child? Because if I let puberty go ahead, then you have facial hair, for example, which would be very distressing, and reversing it, very protracted. Once the voice breaks, you can't make it high again. And those are things that the children then have to go through. So in my view, as a parent, I have to weigh that up and ask, what is the greater risk?
Emilio finds it upsetting that he's often not perceived as a boy. He too wants to begin testosterone therapy. But his dad is against it. Emilio has stopped asking.
After it didn't go so well last time, I haven't tried again. I know it'll just be exhausting. Because the answer is always the same: no.
So Emilio has to wait another 3 years until he's 18 before he can begin his transition. And in the meantime, go through puberty. Manfred's no is final. He doesn't believe that Emilio is trans.
Well, she told me herself that she had a lot of time during the coronavirus pandemic and stumbled on this whole topic on YouTube. During the hormonal upheaval of puberty, she's picked up on an interesting topic, so to speak. And now it's hard to pull her away from it. And as her father, we see each other every 2 weeks or just once a month, or we talk on the phone every now and then. There's just not much influence you can exert when the rest of the outside world in Ami's life, or a large part of it, is pushing the whole rainbow thing.
Can trans teenagers really persuade other young people to become trans? Today, Emilio is visiting an advice center called Courage.
Put your things over there and sit yourselves down.
Social worker Robert facilitates these meetings for young people.
So do you get what we're doing?
I always see friends here that I don't get to see much otherwise because we're in different schools or whatever. So it's like my favorite place.
It's a safe space that you don't have at school or at home, for example.
A safe space where the teenagers are accepted as they are and where they can speak openly about what they're experiencing.
You get treated like you're not really a full human being, as though human rights don't apply to you just because you're trans or queer, as though you can do whatever you want with that person because they're a trans person.
Last Tuesday, I got death threats from kids at my school, and the only reason is because I'm queer. They said they wanted to slaughter me and stuff.
That's terrible. Have others experienced similar things?
Usually people only come up to me in public places or on the street. You know, they make stupid comments or whatever, insults. Or I get barked at.
So you just mentioned people barking at you. That's a verbal attack, but it's already so normal for you. These are the things that shock me every time.
Transgender people frequently suffer violence and hatred. People who don't fit into the binary male-female mold often attract hostility. But is there any truth to the idea that young people's peer groups can encourage them to identify as transgender? The fact is, requests for counseling have increased. So much so that in many places there aren't sufficient services to help them.
That's
partly because those who are really affected now have more courage to come forward early on. In the past, some never plucked up the courage and ended up committing suicide. Today, our society allows people to come out and to address it, so that those who are really affected can get into a system where they can be helped better and sooner.
But is that the only explanation for the increase? Can peer pressure develop when queer school friends meet up, or at places like Courage? Can you be talked into sensing a mismatch in your gender identity? Something that can cause severe distress, known as gender dysphoria.
Of course, we see that in the general, colourful queer youth culture of today, that gender roles are perhaps more radically challenged than in any previous generation. That encourages young people to experiment and perhaps even temporarily consider the idea of being trans. But that has nothing to do with the gender dysphoria in the young people that we deal with here. To imagine that this could be suggested by social influence, these narratives of seduction or contagion, they've been refuted in the case of homosexuality, and they're just as absurd in the case of transgender identity.
So it's not down to outside influence. But why then is a small percentage of the population trans? Blake's parents, Mika and Volker, have wondered about that too.
Charlotte?
They've long since dismissed the idea that Blake's transgender identity is an expression of puberty or teenage rebellion.
Cool.
Could it be that his identity was always evident?
Off you go then, the first game's starting.
Auf zum ersten Spiel.
She's quite boyish, isn't she? Also in the way she looks.
Yeah. She just needs a stag on her t-shirt.
Like Blake, many children display traits conventionally linked with both boys' and girls' behavior, but still aren't trans. For around 20 years now, scientists have suspected that trans identity develops before birth. It could be caused by hormones released by the mother during pregnancy.
The link with pregnancy is one hypothesis that we're exploring. There may be effects on brain development during pregnancy that ultimately determine how gender identity is experienced later in life.
For a long time, transgender identity was considered a mental health issue. It was only in 2022 that the World Health Organization changed its classification and guidelines.
In the past, people tended to focus more on possible psychodynamic causes or the effect of conflict or things like that. Today, we tend to view it as a normal biological process, just like with homosexuality. There's no specific reason for that either. It's simply part of the diversity of human life.
International studies suggest between 1.2 and 2.7% of all young people view themselves as transgender. By no means all of them undergo transition. Of those who opt for medical intervention, around 1 to 2% later regret the decision. The more an individual proceeds with the transition process, the harder it is to reverse. So young people who believe they're trans should still proceed with caution and keep checking that they're on the right path. Like Kira.
I've been doing this now for 3 or 4 years, and I've noticed that things are better for me, and that I feel more comfortable in myself. Of course, I still get the thought sometimes, about once every 6 months, what if I'm doing the wrong thing? At first, I had the thought a lot more often, but I'm kind of growing out of it now. Because I just realized the way I am now, I can't imagine myself any other way now.
At the age of 16, after taking puberty blockers, Kira decided she wanted to begin hormone therapy. Her parents gave their consent. She will now have to take estrogen for the rest of her life.
This is like the first major step, of course. The hormone blockers were too, but that was more like a rescue for me, something I needed immediately, that had to happen right away. But with the hormones, I'm now changing in a specific direction towards the life that I've imagined. So it's the first step in that direction, and more serious, I'd say.
But what are the long-term effects of taking hormones for many years? It's not something that's been studied very much. The University Hospital in Tübingen is looking to change that.
I'm Birgit Dantel, and I study the influence of sex hormones on the body. One aspect that has been studied very, very little to date is how gender reassignment hormone therapy affects trans people. We actually see a very quick response to testosterone therapy in trans men. There's quite a rapid improvement in mood and, above all, activity levels, a sense of energy and a desire to be physically active. Versus trans women who are given high levels of estrogen and androgen blockers. There we see that their mood deteriorates or becomes more variable. And some tell us that they got cold feet about the whole thing as a result.
The researchers are not just studying the mental health of trans people. They're conducting a scientific study to see how hormone therapy alters the brain. The people participating in the study are undergoing regular MRI scans of their brain function over a period of 3 years. The researchers compare these results with those of men and women who do not identify as transgender. One thing is already clear: the brains of men and women function differently. So what about trans people's brains? Is a gender assignment recognizable? And does that change during hormone therapy?
I hope everything is okay. So we'll start taking some measurements. If you see a male face, please press the left button. If you see a female face, press the right-hand button.
The test subject, in this case a trans man, is shown pictures of different faces and asked to identify their gender. Men and women differ not only in their levels of accuracy, but also in which regions of the brain are active in this process. So what about trans people?
We can see that their brains differ from the men and women taking part in the study that have no gender incongruence. There are control groups, so to speak. And we can see there are already differences before the gender hormone therapy has been started.
The preliminary results of the study show that hormone therapy causes the brain to develop more and more in the direction of the perceived gender. So a gender reassignment also takes place in the brain. Could that happen with Blake soon, too? He recently embarked on a fundamental change. 3 weeks ago, he received male hormones for the first time.
I went to see an endocrinologist and brought her the assessment from my therapist. And she read it through. And I thought, I'll give her the assessment and then I'll have to wait months while they send it to the insurance company and have everything checked or whatever. But nope, she read it through. It's an expert assessment, so she just said, the diagnosis has been made and that's it. I just prescribed the medication for the diagnosis. That moment was wonderful.
Suddenly, everything's moving forward a lot faster than expected. Blake now takes testosterone every morning in gel form. He's read through the information that came with it.
The possible side effects are a lot less than I was expecting. The worst thing is that the risk of having a heart attack is now just as high as with all other men. Because the higher risk is linked to testosterone, and that affects half the population. So now I'm included.
It can take up to 5 years for all the physical changes caused by the testosterone to become visible. Blake plans to wait that long before making further decisions.
Until I'm 25, I say strictly hormones only. I think surgery is something that you need to think long and hard about. And if I go for surgery, then only breast removal. Nothing more.
In all of this, I can see that Blake is doing really well. Somehow it just fits and is wonderful. But then I did think, okay, but what about his fertility and the ability to have children of his own later? This is setting up very clear prospects for the future and ending certain other prospects.
It's something Blake has already thought about himself.
I never want to give birth to a child. Firstly, I just can't imagine being pregnant and everything because that's just so feminine. It doesn't feel like that's something that could ever happen. And I'm pretty sure that I could be a father without my genes being involved.
Blake is hoping that the testosterone will give him a deeper voice, and that he'll finally be able to build up some more muscle while working out.
Hello, what you doing?
Looking at your amazing photos.
Emilio currently has therapy once a week. Because of the problems with his dad, he now sees a psychologist more frequently.
When's the next session with your therapist?
He doesn't yet have the medical and psychological assessment needed to begin a physical transition.
Is there any discussion about gathering assessments for starting testotherapy, or has that taken a backseat?
My therapist wants to focus on things like school and the stuff happening right now.
Sachen, die halt im Hier und Jetzt geschehen gerade.
Because so much is going on at the moment.
Yeah, I know. So testo isn't so urgent?
It is for me.
I know he's under enormous strain right now, whether it's issues with school or the issue with his dad or future steps towards transition. So much stress and then the self-harming, which sadly still hasn't stopped. So it's very important to me that he gets therapy and the continuous support that he needs. You have always been and will always be my Ami, and I'll do whatever I can for you. Sorry.
In my personal dream world, what would be best for me is a world without discrimination in any area. I just want to achieve my goals. I want to get testosterone and then have a mastectomy, and otherwise just be left in peace.
Blake, meanwhile, has now been on testosterone for 3 months, and it's beginning to show. Every day he does strength training in the basement.
I'm building up muscle way faster, at least 3 times as fast. And my testosterone levels are still way below normal.
His voice is also getting deeper, just like he'd hoped.
I've noticed that my Adam's apple is dropping. I can even see it in the mirror. And lots of people have noticed that my voice is changing. I feel now that it's completely right, and that it will always be right. You never know what's going to happen in life, but since I've been taking testo, I just feel that it's absolutely right.
Kira has been to the town hall today to collect her new personal identity card, after waiting for the prescribed period of 3 months. Now her ID finally shows her first name as Kira.
Hi there, did everything work out in town?
Yep.
Show me. Wonderful.
You're forced to out yourself a bit when you show an ID with a man's name. It's a bit difficult. This will make things that little bit easier in daily life.
Now it's right, and like you wanted.
Yes. So there are really only a few things you need to know about transgender people, because everyone's individual anyway. When someone comes out as trans, it doesn't mean they're suddenly a different person. It just means their gender changes in the eyes of the observer. And that's it, really.
Most researchers believe that transgender people can't choose or change their gender identity, and that action needs to be taken as early as possible to make their lives easier. However, many children and adolescents do go through phases where they experiment with gender roles. That makes it difficult for parents to see whether a transgender identity is permanent or not. Much more research is needed in the relatively new field of transgender medicine. While experts can offer recommendations, ultimately, parents do have to make decisions and bear the risks, together with their child.